Hello, you are welcome to the Foods That Heal Pageant, where I will be discussing about onions. That is, its nutritional facts, its medicinal and healing uses, its contraindications, well, that is, if it has any contraindications at all, we'll see, and its precautions. I am Damilare Dada from the Northern Caribbean University. Now, to show you an example of onion, what I'll be presenting on, this is an example of onion. Now, we have three varieties of onion in the market, available in the market. We have the red onions, the white and the yellow ones. Regardless of the one you have at home, we are going to be learning of their nutritional benefits, and I can tell you, they are nice things that you may not know, things that you will probably know, things that will be new to you, I hope. Okay, onion, it's a wonderful bulb vegetable. That is, we can count it as a vegetable. Yes, it is one of the oldest edible food ingredient known to humankind. Many years ago, it is part of the Indian cuisine. The Chinese eat it a lot, and even commonly in the African countries. Onions are staple foods in Indian cuisine, African and Chinese. It can be eaten raw, and it can be used as a food ingredient, as a recipe for food ingredients. That is, you can slice it, you cut this part, you cut this part, you take away the outer covering, then you can slice it and eat it. Maybe probably when you are taking your fruit salad, yes, you can slice it and put it, and you can even add it and as a food recipe. Probably you want to make a stew, you're making rice and peas, you just slice some and put there, or probably you want to boil some beef or chicken, just slice it, put it there, it gives it a taste. Botanically, onions belong to the Aliceae family in the genus Allium, and it is known scientifically as Allium cepa. That is Allium cepa, Allium cepa. It is a small herb plant that grows about 2 feet tall. It takes an average of 3 to 4 months to harvest. That is, from seedlings to harvest, it takes about 3 to 4 months. So if you probably want to think of, if you're a farmer, you want to think of something to grow, it takes about 4 months and it's ready for harvest and you can sell. I'm telling you, it's very lucrative. Its health benefits now, because of our time, it is rich in soluble dietary fiber. It is rich in phytochemicals, compounds such as allium and allyl disulfide, which has anti-mutagenic and anti-diabetic properties. Well, what I mean by anti-mutagenic is it has the capacity to prevent you from having cancer, and anti-diabetic, it helps to lower the blood sugar level. It is also found to have antibacterial, antiviral and antifungal properties, all in this onion. Consumption of this onion helps to prevent gastric ulcers, by scavenging free radicals around and by preventing growth of Helicobacter pylori, the organism responsible for ulcer, the Helicobacter pylori. It can also be used for digestion problems, including loss of appetite, stomach upset, etc. It can also be applied directly to the skin. Maybe you have insect bites, wounds, or light burns. Onion can be applied directly, topically. You just slice it and apply it on the surface, and it heals. Now, let's talk about the side effects of onion. Onion is safe when taken raw, when taken by mouth. What I mean raw is you don't need to cook it. Its side effects, well, some say basically is the taste and the breath it leaves on your mouth. The breath and the taste it leaves in your mouth, that is also side effects. So I will advise you, if you are going for a date or for a meeting, don't eat onion raw. Don't eat it orally because it tends to bring out some taste. So, Alright. The contraindications of onions. Well, the contraindications have not been identified. However, due to fibrinolytic action of onion, there may be contraindication in cases of active hemorrhage or when treatment with anticoagulants are used. It prevents blood clots. So if you are having concern with hemorrhage, or you're having hemorrhage, or you're taking an anticoagulant, it's advisable to just limit the amount of onion you eat, or you just stay away from it. Now, what are the precautions? Well, we've all heard about this saying that too much of everything is bad. It's not good. Now, pregnancy and breastfeeding. When you have pregnancy, when you are pregnant, and when you are breastfeeding a baby, it's best to just limit the amount. It is just a precaution, but it's not that it has effect. Just to monitor what you eat that time. Also, bleeding disorder, precautions must be taken when consuming onion. Also, if you are a diabetic patient, you have blood sugar, because of its anti-diabetic properties, care must be taken in the consumption, the amount of onions you consume. In other words, you just have to check your blood sugar level always to monitor, in case if there is a drop down, to keep your blood sugar moderate. Also, in surgery, it will be best to just watch the onions that will be consumed, because of its it has anticoagulant property, prevents blood clot. Because it prevents blood clot, and in surgery you won't want to lose much blood even after the surgery. So you just take precaution in taking onion. Now, a brief recap of what I just presented. I told you about the botanical name of onion, its family and its genus and its scientific names, and I talked about its health benefits, anti-mutagenic, anti-diabetics, its contraindications, its side effects, and the precautions while eating onions. I believe I've passed the message across. So go ahead, buy some onions, eat them, and enjoy the nutrients in it. Thank you so much.